Last year, 400,000 people left jobs in adult social care. But there is hope that new virtual reality training for students could help to try to reduce that figure.
The headsets allow students to react to challenging situations in a virtual reality or VR setting, meaning they'll hopefully feel better prepared when it comes to treating real people. Amrit Birdie reports.
Qualifying for a job in healthcare requires years of training, and for good reason. These physiotherapy students at Teesside University will one day be responsible for the care of countless sick people. But how do they feel about technology such as virtual reality replacing some of the more traditional teaching methods they're used to?
It gets you a bit more emotionally involved rather than learning from a screen. It makes you feel like you're working on a real person, definitely.
When you've not got the actual patients or anything with you, using the virtual reality is going to help because you can look inside the body as well to get more of the anatomy.
Nothing really beats interacting with a live patient that's going through a particularly challenging time. But we also want our students to learn in a safe environment. We also want to be able to give them experiences that they may not necessarily have had out in practice.
For many students, virtual reality is the reality of learning on courses such as health and social care.
Michael, is that you?
The hope is that by virtually tackling challenging scenarios with digital patients, they'll be better prepared for the realities of working when they qualify.
When the students are in the headsets, it's not just about what they are seeing and what we can see them doing within this scenario. It's also their body language and the way that they react on the outside. VR creates a wonderful opportunity for the students. They're all internet savvy, they're all technologically savvy, and it just really creates a separate dimension, something that we can't create in the classroom.
Sorry, Amy, I really need another pair of hands.
Those behind the technology think that developing the students' emotional resilience is the key to not only creating better healthcare workers, but ones that will last.
Being able to kind of fully immerse the students provides us with kind of an opportunity for them to experience that in a way that they wouldn't be able to unless they were kind of on placement. And because placements are so difficult, giving an opportunity to virtually create emotionally difficult encounters that they are going to experience in the workplace before they even kind of get there is utterly invaluable.
But can virtual reality really compare to looking after patients in real life? Some of these students have already been putting that to the test.
Sort of gives you like an actual expectation of what to do there, so like you don't expect anything that's not actually going to be there, you know what would be in the setting.
I work in a care home as well, just like learning from here, and it's like so similar as well. So it was like I get it and I was like, oh, I think I know what I'm doing. I'm used to what's going to happen and stuff. So yeah, it gets me ready for the outside world.
As advancing technology helps these students in ways that never could have been predicted, those behind the VR project say they hope that every student training to work in healthcare will one day get to experience learning in a virtual world. Amrit Birdie, ITV.